So Getting to Outstanding is part of a national programme to improve palliative and end-of-life care, and Dorset is one of 7 sites across the country, and within Dorset, Purbeck is one of the participating sites, and we're just really keen to explore how palliative care in the community is working, how people are being well supported at end of life, because we know that if we can get that right, if we can help to support people really well at home, that means they're much more likely to have a good experience of those last days, weeks, months of life. But also it means they're less likely to need to go into hospital or into a care home. So trying to support people really well at home is part of the aim. And really excited to hear more about how the community support workers work in Purbeck. It's quite a unique model, and how the whole team works together to help support people. It's been such a real joy to work with the team here, and I think they're not called Rays of Sunshine for nothing. I think there's such a joy and a good humour and real collaboration and teamwork that really helps, and I'm sure that has a ripple effect in the work they do.
I deliver end-of-life care to people that choose to want to die at home, and it's a privilege to be able to have this service in Purbeck. We also bridge gaps within care. If people are deemed that they need a long-term package of care, we will bridge that gap. So it's about, on the day, what that patient actually wants. It's not a task. It's about the person on the day, and what type of care that they would like to receive, whether that be a full bed bath, hands and face wash, or just a chat sometimes, or just making them a cup of tea. It's just what they want on the day. From my experience, about a year ago, I was able to stay with the patient from the time that I started delivering care, because our capacity was quite low at that time. And I stayed for 4 hours that day with that particular patient, because I could see within the home, because I look at my care holistically, so within the home, the husband was a bit fraught, he was a bit stressed, he wanted to go out in the garden, but he didn't feel that he wanted to leave his wife in the house on her own. So I knew that I didn't have any other visits after that visit. So I got in contact with my line manager and just said, is it okay if I stay for a few hours just to give the husband a bit of time out? He was in the garden, I could see him wandering around, he wasn't far, so if I needed him I could have called him. What matters to me about last years of life are being able to do the things that they want to be able to do if they're able to, and towards the very end is for them to be comfortable, for them to be pain-free, and for them not to be frightened. And obviously that is, a lot of the time, that's combated with medication and things that can help with that. I think being frightened for me is the most important, and being, knowing that we are there to help with not just care, with reassurance, and things like that. The only thing that I can honestly say that sometimes gets in the way is sometimes we're not always available to deliver end-of-life care to end-of-life patients, because our capacity is sometimes taken up with ordinary care visits. That's the only thing that makes it more difficult, is the fact that we can't always be there at the time that we're needed. Sometimes it doesn't always fall into place with the other care visits that we have, but things are improving. They are very, very, going forward, it's improving all the time. The difference we make comes across from the families, from the patients. They call us Rays of Sunshine, daffodils, marigolds, all sorts of lovely, wonderful names. They know us because of the colour of the uniform. It's a conversation starter, so the minute we arrive at the home, it's wow, this lovely, bright, vibrant colour. Really sets everything off. It's a conversation starter right from the word go, and everyone, I don't think in the whole time I've been doing my job, nobody has ever said or that we haven't, as a team, as an individual, we've never delivered the right kind of care. I work with an amazing team within Purbeck. We are very, very privileged to have this service in this area. And I just hope that we can expand at some point and deliver this care to the people that need it. But no, I love my job. I can't wait. I'm awake very early in the morning and I can't wait to put this uniform on and go to work.
Personalised care to me is whatever it means to the person I'm looking after. So as part of my role, we would go in and assess a patient and we would get to know them as a person. It's different from ward nursing in the fact that we get to spend more time with people. We get to know them and what matters most to them. So it might not be healing their leg, it might be being able to go out and walk their dog, so it's whatever matters most to that person. Some people just like to talk before they have the nursing care. So, to have a chat about how they're feeling, because we might be the only people they see in a day. So it's a lot about talking as well as providing the nursing care. When it's going well, palliative care is a calm environment. It can look like lots of different things, but someone could be in bed and very settled with their family around them. The medication that they need is all in place. Everybody knows the support that's available and the support is in place. They're not wanting anything. They've got the right equipment for them to be able to remain at home. They're in their own, or they might be in a hospital bed or they might be in their own bed. They've got their own duvet. Everything around them is just as it was before. Palliative care is easier if you have the discussions earlier and they're open discussions, and then things can be put in place to be able to provide the care that person needs. If discussions are had later on, and then it becomes quite fraught and it's more difficult to support that person to be able to receive palliative care at home. Often patients will say, we're making a difference, we're so glad you're coming in, please come in. Even if we're not doing anything, just the fact that we're going in to sit with the person and support the family, they're very grateful. As a community nurse, you build a connection with someone, you know that person, you know they might be in their last years of life and you know how they want to die and where they want to die. So if you fulfil that wish, without them saying it, you know you're doing, you're supporting them to remain at home. I'd like it to be true, to be said that everyone I've looked after has had a good death. And people think those two words don't go together, but they do.
My view of palliative care is very different compared to before my placement, because this is my first time looking after a palliative patient in their own home. And before then I used to think it was a very scary thing. When I went to look after a patient in their own home who was end of life and then she sadly passed away, I then realized it wasn't that scary, and it's a beautiful thing to look after a patient at their last moment in their life and after they passed away. So that really has, from that I've learned so much. I think everybody deserves to have a good ending. Yeah, and it's a very rewarding job. For example, the district nurses and all the other teams, the job that they do to look after patient until the end is very rewarding and it's an amazing thing to do.